Uh, Good morning, good afternoon, good evening, ladies and gentlemen. Um, on behalf of Beacon House, which is the organizer of the School of Tomorrow events, I'd like to take this opportunity to welcome you to a world of tomorrow, negotiating a better future. This is the 11th edition of SOT events, which is part of Beacon House's CSR. These non-profit events were launched by Beacon House in the year 2000, and the key objective is to help inform the direction of the organization and also to to engage global communities in conversations which are about the future of schools and society. My name is Kasim Kasuri, and I am the CEO of Beacon House, a position that I have occupied since 2005. And it's my great pleasure to welcome you today to the 11th edition of SOT events. Before I introduce the esteemed panel, I just want to let the audience know we have a specific protocol for Q&A, which is relatively easy. You have a button on your screen which should say "Ask a question," or if you're on Facebook or YouTube, you should be able to post questions as comments, and we will try to address as many of those towards the end as we can. I will introduce the speakers. First of all, I want to thank them very much for being here with us today. It's been a lot of coordination, and as some of you who are very astute would have noticed, we still have one speaker missing. But in the interest of time, we've decided to start. We are hoping that they may join us later. So we have with us in alphabetical order, we have Dr. Mishal Khan. Dr. Mishal Khan is an associate professor at the London School of Hygiene and Tropical Medicine, which is the UK's top public health university. She's also a consultant at the leading policy think tank, Chatham House Center for Universal Health. Dr. Mashal Khan is a social epidemiologist, which is a word that I've just learned to pronounce before this call, this session. And she specializes in health policy and system research, particularly in South and Southeast Asia. Her focus is to improve infectious disease controls. She has over 15 years of experience in strengthening infectious disease control systems in emerging economies, particularly in Myanmar, Bangladesh, Pakistan, Kenya, Cambodia, and she's also worked in China. She holds a doctorate degree from the London School of Health and Tropical Medicine and a master from the University of Cambridge. Thank you, Dr. Mishal Khan.
Thank you. Great to be here.
We're also very honored to be joined by Baroness Mobarik today. Baroness Mobarik is a conservative member of the House of Lords and was a member of the European Parliament on behalf of Scotland until January 2020. I'm assuming that would be until Brexit. Yes?
Correct.
And prior to entering politics, Baroness Mobarik has had a distinguished career in business. And she co-founded a technology company with her husband in 1997. And she's been active in a number of business, voluntary, and charitable organizations. She was also a member of the Council of the Confederation of British Industry from 2001 to 2011. And then from 2011 to 2013, she was the chair of that council. In 2013, she was awarded an honorary doctorate degree from the University of Edinburgh in recognition of her contribution to the business community in Scotland. Also in 2013, she was awarded the Tampai Imtiaz by the government of Pakistan. So I guess 2013 was a good year for Baroness Mobarik and for Pakistan. And finally, last but not least, we're very honored to be joined by Mr. Shafqat Mahmood. Mr. Shafqat Mahmood is the Pakistan Federal Minister for Education, Professional Training, National History and Culture. And this is a position that he has occupied since August 2018 when the present government came into power. Last November, he was elected as the president of UNESCO's Education Commission. He's an alumnus of Government College Lahore, University of the Punjab, Harvard University, and the University of Southern California. And also, he's a very important person in my life because he's the Education Minister of Pakistan, and as some of you must know, I run schools in Pakistan. Um, so I'm very, very thankful to all the panelists for being here today. I do want to mention that we were expected to be joined today also by Mr. Andreas Schleicher, who is the head of OECD Directorate of Education and Skills. Now, Mr. Andreas Schleicher had a last-minute emergency, and he has promised to do a 30-minute one-on-one session with me tomorrow. And in fact, he had said that his second in command, Dr. Damme, might be joining us today, but I guess you and I will find out together if that happens or does not happen. Ladies and gentlemen, before we get into the actual conversation with the esteemed panelists here today, I want to just talk a little bit about this conference, okay, and particularly this panel discussion. Now, the objective of this particular session is to really lay the foundation for the next 3 days. Some of you probably know that we have 20 sessions over the next 3 days, which include panel discussions, interviews, workshops, seminars, presentations, and with people from all over the world. It's been quite a task putting it together. I was just telling the panelists before we went live that there are people from all over the world, from North America to Australia, and organizing the time slots has been a big challenge. Now, I'm often asked by people why we organize these conferences, and I think this is an important point because, as most people watching today would know, Beacon House is primarily in the field of education. We run private schools in a number of countries across the world. But because we run schools all over the world and we have over 300,000 students in our schools in different countries, we feel that it's almost a moral obligation for us to try to understand what the future holds for these students. Because what I feel is that many of them are attempting an education which is not very different from the kind of education that their parents were in. Oh, we're honored to be joined by Mr. Andreas Schleicher, the Director for the Directorate of Education and Skills at the OECD. Welcome, Mr. Schleicher. I really appreciate your joining us today. I know that you've had a lot of last-minute complications. Can you hear me?
I can hear you, yes.
Okay, brilliant. I'm just very quickly going to, I believe you have met the Federal Minister for Education for Pakistan, Mr. Shafqat Mahmood, who's now in the top right corner, assuming that your view is the same as mine. We have in the bottom right corner the Baroness Mobarik CBE, who is a British politician, member of the House of Lords. And in the top left corner, we have Dr. Mishal from the London School of Hygiene and Tropical Medicine, who is a leading epidemiologist. And I still can't pronounce that word. And welcome. Thank you for joining us. So I was just explaining to the audience and to the panelists why we organize these conferences, and it's because we feel that we have a kind of responsibility to look at the kind of education which we're providing in our schools, because unfortunately in many schools around the world, as you probably would know better than most of us, kids are going through the same education that their parents went through, except that it's a very different world. The world that they're going to grow up is not going to be the same world as their parents. So over the next 3 days, we will hopefully be exploring new paradigms of learning for the future. And we're not just looking at it in the context of COVID. This is one thing which I feel is very important. We're looking at it in the context of the future of education. But COVID has kind of given everybody, if I may, a sort of kick in the backside to want to really look at what's going to happen in the future. We will also be looking at the creation of safer and more balanced futures for generations to come. Um, so, ladies and gentlemen, we are very honored to have today also a very special message from the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. And I do hope I've pronounced his name correctly. And I'll request my backstage team to play that message now.
Excellencies, colleagues, and friends, it's an honor to join the opening session of the School of Tomorrow conference. This is a challenging time for our world. COVID-19 has impacted all of us, exposing weaknesses and inequalities in every nation. The reality of our interconnected planet is that nobody will be safe until everybody is safe. That's why we must work together in global solidarity to tackle the pandemic. I want to recognize the government of Pakistan for its comprehensive response to COVID-19. It's important that measures to contain the virus are accompanied by efforts to mitigate the social and economic impact of the response, especially on the most vulnerable populations in our societies. It's also critical that essential health services are resumed as quickly as possible. WHO is working with the health authorities in Pakistan and around the world to help restart vital polio programs, routine immunization, and other services. But we should not just think about going back to the way things were. This is a turning point in our collective history. Conferences like this are an opportunity to think about how we rebuild a safer, more resilient, and equitable world. I thank you.
Okay, well, that was nice. I'm truly very thankful to the Director General of the WHO for that brief message on the conference. It's not something that they normally do. Um, I would like to request my panelists to perhaps welcome Dr. Van Dam. Thanks for joining us. I'd like to request Dr. Van Dam is the special counselor from the OECD as well. We're very honored to have him here. And he will be here for the full session, and Mr. Schleicher might be leaving later, and then we have a special session with Mr. Schleicher tomorrow. So, Dr. Khan, I want to start with you, which is kind of predictable. As you just heard right now, the Director General of the WHO was fairly gracious, I would say, about the way in which the Pakistan government has handled the COVID crisis. Now, I don't necessarily want to get into Pakistan in particular, but I'm just wondering that as somebody who specializes in this field, have you been able to identify any kind of patterns or in terms of how both emerging as well as developed economies have handled COVID? And let's say if you, for context, we could actually talk about Pakistan and the UK because you are based in the UK.
Yes, sure. I'm very, very happy to do that. So I think I would start by saying that one of the things we've seen is that this distinction between developed and emerging economies or higher income and lower income countries as far as how effective their responses have been, that might have been what we'd expect going in, but that hasn't been the feature that's distinguished whether a country has done well or not. I see that as being quite positive, really, because often when we go into this, some of the countries that have less resources available towards their public health programs assume that they're going to have to end up with worse outcomes. But we have great examples. Vietnam is one where even with lower resources, the countries have managed great control. And unfortunately, I think we can just meet, yeah. In the US and in the UK, even with a lot of resources, there have been concerns with the response. So I think that's the first thing to start off by saying. The other, I'll make two main points. One is in terms of the way that responses have been structured, one of the common challenges and I think concerns from the public has been how expertise, particularly scientific expertise, has been involved in shaping how politicians have handled the response. And I know certainly in the UK that received a lot of questioning and criticism early on, like who are the advisors, what are the advisors telling the government, and how is that scientific advice being used? In Pakistan, that question also remains. I think in the UK it's been great that it's evolved, and some of the pressure from the public and journalists has meant that a lot of transparency has come about. In Pakistan, for me, we still have that question about exactly who's making the decisions, what are the decisions being made on the basis of, and I think this is a really critical question. The other common elements that I've seen is that in both higher income and lower income countries, what I call the cracks in our society have really shown up in terms of specific groups that have been neglected in terms of income security, access to water and sanitation, access to healthcare, and that's where there's been a lot of vulnerability to infection. So that's something that's common across higher and lower income countries.
Thank you very much, Dr. Khan. We're going to come back to that. It's interesting you noted that there does not have to be a difference between developed and developing countries per se, but we're going to come back to that point later. I'm conscious that Mr. Schleicher has to leave soon, so I'm just going to come next to him with a quick question. Mr. Schleicher, I don't know if you want to reflect on what the WHO Director General said, but the thing that I really wanted to ask you is that The Guardian recently quoted you as saying that we should certainly, after COVID, not go back to normal because normal meant that we were educating people, and I quote, as second-class robots, rather than developing the human skills that are increasingly what will matter most. So I just wonder if you want to quickly, explain that statement of second-class robots to us.
Yeah, well, first of all, I actually want to congratulate the government of Pakistan for reacting quickly to the crisis and dealing with the immediate health situation also in education. But it is far easier to close schools than to open them in a meaningful way. And you're not alone, worldwide, 1.5 billion young people have been locked out of their schools. And one thing I think they take away from this crisis is that, learning is not a place, but an activity. That we need to do better to bring education and technology together, and that we need to think more about the qualities of education, qualities of young people that education should develop. When I mean that we are good at educating second-class robots, I mean that we are usually teaching young people the established wisdom of our times. We ask them to repeat things that we tell them. We do too little to teach them to question the established wisdom of our times. In a way, artificial intelligence has become very powerful to use and extrapolate from what we know. The ingenuity of people is now at a premium. The kind of things that are easy to teach, maybe easy to test, have become easy to digitize, to automate, to outsource. If we want to educate young people for their future rather than our past, we need to think very carefully about those kinds of human qualities. And I do believe the COVID crisis presents an opportunity. Young people who have learned how to learn, who can manage their own learning, who have the right parental support, who have access to innovative technology, for them this period has been liberating and exciting. But for young people who have been spoon-fed by their teachers, who learned little bits and pieces of knowledge, who did not have the parental support, not access to technology, they have been left very badly behind. This crisis has amplified education inequality, as also Dr. Kanis just said. And this is a sort of bleak reminder that, going back to the situation before COVID cannot be a goal. This crisis presents an opportunity for us to do things differently. And actually, what I should also say, in Pakistan, there have been many teachers, many schools, many institutions rising to this challenge. And this is true around the world. We have seen so many innovative learning environments emerging, using new technologies, using new pedagogies. And I think this is something that we need to foster, that we do not, go back to the status quo when things return to normal, but that we educate young people for their own very special future.
Thank you very much. I could not agree more with you. In fact, we have a session for our audience at the end of day 3, which talks about new competencies, skills, and values, which we need to inculcate for the future, because we really cannot continue educating children for a world that doesn't exist any longer. But one of the things, Mr. Schleicher, you said, which I thought was very interesting, was this comment about how it's far easier to close schools than to keep them open. And with that, I want to come to the Honorable Minister for Education for Pakistan, and just to get his comments on this, because schools in Pakistan have been closed in certain parts in February, in the rest of the country since March. And I want to ask the minister 2 things really. One is if he is satisfied with the way in which the government has handled the continuity of learning at our schools. And the second question, of course, which many people actually requested me to ask you, sir, is when schools are actually going to reopen. So over to you.
Well, thank you, Kasim. Thank you for inviting me to this meeting. I'm hoping to learn a lot from this. I think at the outset, we need to recognize that the challenge that this pandemic has posed is unprecedented. So nobody had SOPs ready. We did not have any kind of precedents to go by. So therefore, we had to respond very quickly to the challenge, which was unusual challenge. So one of the things that most countries did in the world, and which we did too, was to close schools, because we did not want the children to be exposed. And the children's health came first, obviously. But as has been stated, it's easy to close, but not so easy to open. And we've been spending a lot of time looking at this issue, that what kind of benchmarks should we keep in mind when we are ready to open schools. We have, day before yesterday, had an interprovincial meeting, and we have announced that we hope to start schools in Pakistan by not just schools, all education institutions, by the 15th of September, because there are some events happening in August which would necessitate us to very closely monitor how the disease spreads. So I think the factors that will determine for us to finally give the go-ahead would be the infection rate, obviously infection rate among children, but also in the society as a whole. We'll have to look at mortality and things like that. We'll have to look at the ability of our schools to enforce SOPs. So these are the kinds of things that will determine finally when we open. But we are very keen to open. I think children have suffered, the education of the children has suffered a great deal. Some of the, some of the schools have had the ability to do online courses, but that is not available to everybody. In fact, vast majority of the schools in Pakistan do not have the ability to start online teaching. In any case, one of the challenges that we face is internet connectivity, for which we are now trying to do something. So as far as the learning question is concerned, from what I understand is that how has learning proceeded during this period. As soon as the schools closed, we very quickly scrambled to get a tele school on air, which broadcast 10 hours of lessons from class 1 to 12 every day. And we've been doing it for 3 months. And we are also now beginning to develop new content. So on that side, we are also developing a program for the radio, so that where the television cannot reach, the radio can reach. So this was something we were able to get off the ground rather quickly. But now we are also looking at this as an opportunity to develop our ability to improve our distance learning methodology. And we have now started a program for developing new content. We are also trying to translate into Urdu the Khan Academy content. So there are different kinds of things that we have started. We are now launching a portal which will have all our lessons or the touch of a button to every student, whoever wants to go. But then again, internet and ability to have a computer is not available to anybody. So there are many challenges, and we are trying our best. Hopefully, this will be the disease will go down and the regular schooling starts. But at the same time, the distance learning that we have started, and I've opened a separate distance learning wing in our ministry. This will go on, and we will continue to develop this part of our teaching and learning.
Thank you very much. That's been really useful for our viewers, especially those of them who are in Pakistan, which is, of course, a large number. I want to come back to one point later, but I'm going to first ask Baroness Mobarik to say a few words. But the point which I want to come back to later is that, there's a lot of talk about whether children have milder symptoms, whether children are carriers of the disease, whether they can infect other people in the same way that adults can. And this is, of course, in the context of schools reopening. So I'm going to come back to Dr. Mishal Khan on that later. But I would like to ask Baroness Mobarik a really important question. And this is of course, something that the Director General also referred to in his opening comments. Now, as we know, governments in the UK, where you are from, and across the world have imposed lockdowns. Okay, and this has resulted in pretty massive unemployment. I think by some estimates, it's like 35 to 40 million people just in the United States. So the question that I want to ask you, given your background in business and in commerce, is that can we really justify the destruction of economies just because of a virus? Because ultimately, if the economies are destroyed, then people are going to die of hunger, which is what the Prime Minister of Pakistan also keeps saying. So I'm just wondering if you have any thoughts on this.
Well, I think the decision to lock down a country could not have been an easy one for any government. But I think at the time, it was the right one. We're not talking about any old virus. These were decisions made in the face of a highly contagious and potentially deadly virus. But you're right, the socioeconomic impact has been absolutely immense. And in fact, I think it's too early to begin to quantify what the full consequences of this are. What the UK government has done is to try and mitigate the effects of the lockdown as much as possible with various fiscal and other measures in an effort to protect jobs and businesses. And most recently have announced a raft of initiatives which in order to create jobs and stimulate economic growth. But as has been mentioned before, there are variations across the globe. This is a highly developed economy. Other less developed economies, I think the challenges are going to be even greater. But history shows us that humans have this great inbuilt resilience, which enables them to meet unforeseen challenges. And what is most important just now is to equip our young people as best as we can for the jobs of the future. But I think that we will be facing difficulties for some time to come.
Thank you very much. You are right. It is indeed challenging, especially for countries like Pakistan, balancing between saving lives and saving livelihoods, and that is in fact one of the sessions that we have. We have a debate on that during this 3-day event. So thank you very much for your insight. I want to just quickly come back to you, Dr. Mishal Khan, with the question which I posed earlier before we come to Dr. Van Damme, which relates to the reopening of schools. Can you just tell us very quickly, because there are so many myths surrounding this issue. Somebody said to me the other day that children are, low vectors. I don't know what a vector is, and they can't pass on the disease. Do you agree with this or not?
I think the general sense is that children are less likely to have severe symptoms and therefore potentially less likely to pass it on. They have less viral load. But clearly it's not an impossibility. But I think the health of children themselves is less of a concern because there haven't been a lot of documented cases of children having very severe disease. So the decision to close schools does reflect concerns about not just the children's health, but them potentially transmitting it to family members at home.
Thank you, Dr. Khan. And just for our viewers who have logged on recently, because of the limitation of the speakers' titles on the system that we're using, we've had to cut off Dr. Khan's title at London School of Hygiene. In fact, she is a associate professor at the London School of Hygiene and Tropical Medicine, which is the UK's leading public health institution. I'd like to come very quickly to Dr. Van Damme, and we were talking about how countries in developing and the developed world have handled the health crisis better. Have you been able to draw any parallel in terms of how emerging economies and developed countries have handled the education crisis? Because this is what the OECD does.
Thank you, and also thank you for the opportunity to join this fascinating panel. That's actually a very good question, and we are still very much in the phase of gathering data, so we don't have a full picture yet. But my impression is that the success of policies and the actions that governments have made in education is not in a linear way connected to the distinction we made between developing and developed or emerging countries. There are many developed countries who actually are suffering and who are not doing as much as they could. Let's just take the example of the United States, where we see this pandemic really taking a kind of size and amplitude which is unimaginable. There are many emerging and developing countries who actually are doing very well. And I would personally, as far as the data that I can see, I would count Pakistan among them. It is especially in some countries where I think there is a huge feeling of responsibility, a huge commitment to education, that we see the most successful strategies with regard to reopening schools with all the difficulties that we have, and that also the minister has mentioned with regard to internet connectivity, the availability of digital resources, etc., etc. But as my boss Andreas Schleicher has mentioned, this is a huge opportunity, and I think if we have a kind of implicit ranking of quality of societies and quality of education systems in mind, we have to drastically revise that, because there are many countries who are using this opportunity to take a leap forward in thinking about their education system and how to best serve the needs of all these young people and the diversity of learners. So this is a real moment of change and transformation also in the global world of education.
Absolutely. Thank you for your feedback. And of course, even within countries, there are differences in how different schooling systems, public sector, private sector, between the different schools and the public sector, how they've handled it. So I would tend to agree. I would like to come back now to the Minister for Education. One of the things which I know a lot of people are concerned about, and I'm personally, it's something which I think about a lot, is that the entire focus right now is about how we're going to address learning losses and how we're going to get kids back into school. But what about the 258 million children globally who were not in any school to begin with, even before COVID? And sadly, Pakistan is number 2 on that list. I think we have 22.8 or 23 billion children, according to UNICEF. And even more unfortunately, a lot of them are girls. So I'm just wondering, do you see this number increasing after COVID? Meaning that are we going to see that suddenly from 23 million, it'll go to 30 million?
Well, Kasim, it depends. I think initially there would be a setback on this because many of the schools are closing down. Many of the private schools in Pakistan, which were charging low fees, are not probably going to survive, will have serious difficulty and are having a serious difficulty surviving. Parents are obviously reluctant to pay a fee when their children are not going to school. So that's impacting the number of schools which are available in the private sector. In the government sector, of course, there have been access issues also, in the past also. So I feel that in the beginning or in the first 6-8 months of this disease, this pandemic, globally I see that the number of out of school children will increase. But I'm optimistic. I'm optimistic because now that we are experimenting more and more with distance learning methodology, and now we are developing a program in our ministry where we can use the informal teaching methods that we were already to some extent employing, but now with the ability to use the internet and use tablets through which we can, or even projectors through which we can have lessons beamed in from a far off place onto any village wall or any such place. So I think that there is not enough time for me to go into all the details, but let me put it this way, that we are seriously looking at using technology to access or to reach out to women, reach out to children who are not otherwise accessible. And I think that I'm cautiously optimistic that we will be able to perhaps reach people or reach children whom we were not able to reach before. So I think while this is a huge challenge and a huge problem, but I think there is a glimmer of hope, and there is a possibility that we might be able to make a difference.
Thank you. In fact, you've answered my next question as well, because I was going to ask you if you feel that any of the emerging learnings from the COVID crisis could also apply to children who are not in school, the out of school children. So really excited to hear that the government is already looking at that. Dr. Khan, I want to come back to you for a minute because many people have asked me to ask you this question. Many of us have seen this really depressing cover story in The Economist. And, if it were just some random tabloid online, one could have ignored it. But the cover story basically stated that COVID is here to stay and that we're simply going to have to learn to live with it. Now, this applies to everyone on this panel, to what Baroness Mobarik said about the opening of the economies, what the minister is discussing with regards to school. So tell us, is COVID here to stay, or is there light at the end of the tunnel?
I mean, look, within societies, we are already seeing that New Zealand is moving towards elimination. So, I mean, within countries that have defined borders, of course, one can aim for that. But I think we do have to be realistic. And we've seen that, the cliche that if it exists in any country, then there's a risk to all countries. So that is true. So I don't think this is something that we are going to eliminate quickly. But I would also get us all to reflect a little bit on the fact that there's been many, many infectious diseases that unfortunately we've got used to living with. If we think about Pakistan, there's tuberculosis, which kills 4,000 people every day. There's dengue, there's malaria. So, why is COVID different? I think that we should be concerned about all of these infectious diseases and strive to reduce their impacts.
Wow, I didn't know that tuberculosis kills 4,000 people a day. That's that is news to me. And yes, you're right. There's a lot of hype, I guess. I think part of the answer to your question of why is it different is because these other diseases did not emerge in the time of social media. So yeah, there's a lot of hype surrounding COVID. There is a question which has come in from the audience, and even though questions are meant to be at the end, but I did tell them that if something was really pertinent, because there are hundreds of questions coming in, but they're coming into the backstage team and they are sending them to me. So somebody is asking that until there is a vaccine developed, a number of parents may not feel safe sending their children back to school. Do you have a view on that?
Yes, I do. So I think one of the issues here is also about risk communication and the perception of risk. And this might not be a popular answer, but I would again throw the question back that we do know that children have a very low risk of having severe disease. But if I understand a parent's sentiment of wanting to protect their children, I completely get that. I would ask parents who are thinking about this, why only COVID? We know, I'll give you two examples. There have been thousands of children in Larkana district infected with HIV owing to use of dirty needles. If there's a healthcare system where quality is questionable, every time your child goes into a medical facility, there's a risk they might get something. I'll go back to the example of dengue or chikungunya, where mosquito-borne illnesses, where there's poor sanitation and stagnant water, your child could get one of those. So what are you going to do? Lock your child up in one room and not let them leave? No, that's not feasible. So what I would argue instead is that definitely use the concern for your children and families' health to push the government and be more active on reducing infectious diseases, but don't be so narrow as to only think about COVID and vaccination and going to school. That's not the only thing that can affect a child.
Yeah, absolutely. And it's really sad actually that because of the COVID hype, a lot of people with other illnesses, which are probably far more serious, have not been able to get the kind of attention at hospitals that they really needed to, when people have died as a result. Baroness Mobarik, I'd like to come back to you with a question which you may consider a little bit controversial, but I will ask you anyway. The UN Human Rights Chief recently said that COVID has exposed fault lines at multiple levels, not just in terms of health, but also in terms of ethnic and racial minorities. Because what we've seen is in the United States and in the UK, where you live, a disproportionate amount of people who are getting it, and an even more disproportionate amount of people who are actually sadly dying from it, are people of color. And since you are in the House of Lords, which is supposed to review legislation coming in from the House of Commons, I'm just wondering that has the UK government looked at this?
Well, I think the UK government did commission Public Health England to undertake an inquiry, which certainly did reveal that there were a greater number of people from Black, Asian, and minority ethnic communities dying of COVID-19 than their white fellow countrymen. So I think there are a number of reasons that were identified. First and foremost, many of the people in those communities are essentially key frontline workers. I mean, doctors, nurses, shopkeepers, and many more low-paid frontline workers in transport and cleaning and security jobs who were essentially in harm's way and much more likely to contract this virus. And unfortunately, sadly, many more have died. But I do think that the full picture will emerge in the fullness of time, because if there are issues of inequality or unfairness, then these have to be addressed and put right, because it's simply not acceptable. I think the United States, the same thing there. I mean, I think recent events have actually highlighted a massive problem, an ongoing problem, and that which afflicts Black people in the United States. But I think that particular topic is a much bigger one and would need a whole session to look at that.
Thank you very much. Thank you. I appreciate that. Yes, it is something which is really, really important and connected to a number of other issues. But it's interesting how this crisis has, in fact, highlighted so many other related areas. Dr. Van Damme, I'd just like to come to you quickly and ask you about the learning losses that everybody is talking about. So if I give you the Pakistan example, we had an earthquake in 2005, the Kashmir earthquake, and schools were closed for a couple of months. And research showed that when kids came back to school, they were on average about 1.5 years behind what level they should have been. So what are your thoughts in terms of how we can address these learning losses?
Yes. If you allow, I would just like to come back to the previous question as well, because we have some interesting data that are coming in now. There is a popular saying that the virus does not discriminate, but that's completely untrue. The virus is discriminating, and as you mentioned in your question, against people of color. But we also see that poverty matters, that living conditions, sanitation matters. But we start to understand that actually education matters as much. So there is a steep gradient that lower educated people are more likely to die from infection than higher educated people. We still don't understand very well how this is possible. It has to do probably with understanding of the instructions, the kind of cognitive skills that are needed to perfectly see the risks and to understand the graphs that the television is showing every day. But it has to do also with behavior, washing hands, wearing a mask. These things are part of what I would call social emotional skills, like responsibility, empathy, caring for others, etc. So actually education also has an impact on the spreading of the disease, and especially on the risk of severe illness and death, which is related to infection. Coming back to your question on learning loss, that's a very important question. We have quite a lot of research evidence in the past, and you mentioned the evidence from Pakistan from the Kashmir earthquake, but we have evidence from other countries in similar circumstances, and we of course have the evidence of what happens during the summer months, which take sometimes 8 weeks, 2 months in many countries. And the evidence all points in the same direction. So a longer absence from a well-organized learning context does not need to be a school, but a longer absence is detrimental for keeping up the learning achievements and to progress in learning. So many children, especially those who don't have a stimulating environment at home or in the community where they can practice these skills, for example, numeracy skills and literacy skills by doing and by living, especially those children who don't have these opportunities, they really suffer. And there are serious setbacks which are in the magnitude that you mentioned, sometimes 1 year of setback during the summer loss. That's not exceptional for certain categories of children. So how to deal with that? I think it's very important for education systems to ensure how difficult it is, a kind of continuity in the learning process. And that's not the same as ensuring that schools remain open. There are countries where teachers who are not in school, but they go out to families, they go out to communities to see how they can support children, how they can support families and parents in preparing a kind of learning-rich environment at home. So there are many ways in which teachers can still be supporting the learning of children, even if schools are not functioning optimally. So I personally, I do not like the term school closures because it suggests that schools are completely closed. In many countries, there are much more intermediate forms, and distance learning being part of it, but many other forms as well. And it is very important that for the most vulnerable children, we ensure this kind of learning opportunity, even if it's very difficult to organize.
Thank you very much. I was smiling earlier because this is something that we keep saying to our parents as school operators, that the schools are not closed, only the buildings are closed. Because actually many of our teachers are now working harder than they have ever had to work before. And not only that, but they've had to transition from face-to-face teaching to other forms of teaching, whether it is online or, as you said, visiting homes or over WhatsApp or even telephone calls. These are, and in many cases, it's had to be one-on-one. So yes, that completely does resonate with me. Mr. Shafqat Mahmood, I have a question from the audience, which is because now we've kind of gradually moved into the Q&A portion of the segment or of the session. The question is that how will it be ensured that schools will follow the SOP, and will the SOPs apply to both private and public schools?
Of course, SOPs will apply to everybody, and there will be no exception. I think to start with, the expectation has to be, and the responsibility has to be taken by the school managements. It is very difficult for the government to go and start doing surprise checks of every institution. So there has to be, in a sense, voluntary compliance by school systems, whether they are public or private. And therefore, we expect that is going to happen. But In case it does not happen and there is some very egregious violations that are going on, we do have the option of closing a particular school because my mandate is not just schools, it's also universities and colleges which does not follow the SOP and it comes to our notice, we will certainly guide them, advise them. But in the ultimate analysis to enforce compliance, there is always the option of asking them to close down. So I hope it doesn't reach that point. I hope that everybody recognizes that their own responsibility. I think that at least in the urban areas, I find that more and more people are wearing masks now. So that's voluntary compliance. Similarly, we hope that as far as SOPs in the schools are concerned, the teachers, the managers, even the parents and the students will voluntarily comply with the SOP guidelines.
Thank you. Fair enough. I just hope that we are able to apply these uniformly. And I think where this question is coming from is that in 2014 or early 2015, there were certain, which was a time when Pakistan in particular was experiencing an upsurge in extremist incidents. There were a lot of SOPs that were issued by the government in terms of how security of schools had to be upgraded. But unfortunately, the focus was mainly on private schools and not so much on public schools. So I hope that in this case, we all recognize that all children are important, whether they're going to a government school or to a private school or to a low-cost private school, and that SOPs really should be
or to a madrasa.
And yes, and madrasas. Thank you very much. Thank you very much. Absolutely. Dr. Mishal, I have a question for you, which again, a number of people ask me. I'm sorry, I'm directing all the depressing questions at you. Is this going to be like a 100-year phenomenon? Like, we had the Spanish flu and then we had this 100 years later. Or are we going to see more and more frequent pandemics now? Because again, there's a lot of misinformation circulating about this.
So I think that we will, I'm not sure, hopefully, a pandemic of this scale, there have to be a lot of circumstances that come together for it to happen, but outbreaks of what we call new infectious diseases are becoming more and more common. Part of that is because humans and animals are interacting more, we're going into areas where humans haven't been before. So yes, there certainly will be. And what's going to prevent a localized outbreak of disease becoming a global pandemic will be whether we have systems in place to contain. So it's actually something that we're not passive in. It's our choice. If we're going to build public health systems that prevent pandemics, then we won't have pandemics. But if we don't invest in that and we say that we're caught off guard again and again and again after scientists have been warning about it, then yes, it will be a frequent occurrence. Kasim, you're muted still.
I am indeed. I've been lecturing other people about talking while they're muted for the last 1 month. Yeah. My follow-up question for you was that, is there such a thing as herd immunity, or is that just like some kind of urban or political myth?
So there's definitely you can have herd immunity to infectious diseases. I think the confusion is about, so that's when enough people are immune that the infections doesn't spread anymore. But for COVID, it was, I think, a very misleading concept to start off early on, because we've seen even, say, countries like Spain that have had very high infection rates, only about 5% of the population seems to have immunity. So this idea that it will just spread and suddenly everyone's going to have had it and will be immune, that's not emerging. And also, it's quite dangerous to do that with a new infection, because we don't know what it's going to do to people, what the long-term effects are going to be. So I think for COVID, the idea that we'll just let it spread and we'll wake up one day and everyone will be immune and whoever was going to die would have died. That's a pretty dangerous way of thinking.
Thank you. Shafqat Saab, I have one very, I know it's kind of broad question. If you want to just make a quick comment. This is on girls' education. So you may have seen Malala Yousafzai's address to the Canadian Parliament. It was a bit difficult to see because every 3 seconds there was a standing ovation. But one of the things that she mentioned is that statistics have proven that countries in which girls complete secondary education have witnessed an increase of like, I don't know, $92 billion in their GDP. She also mentioned that those countries have a 50% less occurrence or a chance of war breaking out. So this is countries in which girls are educated. So do you want to just quickly comment on what the Pakistan government is doing in terms of making sure that more girls enter the system?
Well, let me begin by saying that yes, of course, girls' education and girls' secondary school education has a tremendous impact on so many other indicators, and that's the research has shown that. The difficulty that we have seen regarding more widespread girls' education is number one, access, because the parents are reluctant to have their children, girls go far away from home for schooling. So therefore, we will have to move forward and build more schools. But I think that again, I will go back to what I said earlier. New technology is making it possible for us that we don't have to go the brick and mortar route, and we can, as I mentioned earlier, there is a small device which can beam a lecture on any surface. And this kind of thing can bring girl education closer to the homes of the girls and improve access. So once access is improved, the social barriers of sending the girls far away from home would lessen. They will not go away, but they will lessen. There are other social factors involved too. Unfortunately, things like early marriage and so on and so forth, these things also impact girls getting higher education or secondary education. But clearly, I think there is a possibility of reaching the girls much more now with technology than before.
Thank you. I appreciate that. And I think that it will be amazing if we can really focus on girls' education in countries across the world, but particularly in developing countries like Pakistan. Before I conclude, Baroness Mobarik, I was just wondering if you want to quickly add on to what the minister said about girls' education. I know that you have maintained close linkages with Pakistan over the years, so if there's any input you have, that would be useful. Sorry, you're on mute.
Yes, absolutely. I think girls' education, it goes without saying, it's absolutely vital for a successful economy and a successful country, successful society. And we've had a period of reflection these past few months. And I think this now affords us the opportunity to do things differently. We need to aspire to a cleaner, kinder world, but also to a fairer one where everyone has, equality of opportunity. And where there's respect for people of all backgrounds and for all gender should not be an issue here at all. I do believe that there are so many issues that we need to look at, but what young people need to do is to grasp this opportunity to want to embrace change, to continue to learn. It was the philosophy of Allama Iqbal, after all, philosophy of revolution, about constant change. And I think we are in a period of change, technological change, which offers opportunity, and we need to embrace that fully.
Thank you very much for those remarks. I, don't think we could have concluded on a more optimistic note. I'm being told now. I had promised that I would wrap up by 5 minutes past the hour, and we do have other sessions beginning in a few minutes. So I will now wrap up. I would like to thank all of you once again for having joined me today. Dr. Van Damme, at the last minute in your case, please also thank Mr. Schleicher for joining us for a few minutes, Dr. Mishal Khan, Baroness Mobarik, and of course, Minister Mahmood, very kind of you. I think audience in various countries, I know I'm getting feedback from tons of people, really appreciated this. And, I also do want to remind people that once again, that we organize these conferences because they really help us as an educational organization in influencing our own plans for the future, because it's a heavy responsibility to be preparing children for the future without really knowing what the future holds. And these conferences really help us. And I hope that schools, both in the public and private sector, educators, policymakers, and others who are listening today in different countries. Our last online session had people from 48 different countries, are also able to benefit. Our website is www.sotevents.com. SOT again stands for School of Tomorrow. Before I conclude, quick vote of thanks. I want to thank the Director General of the World Health Organization. Initially, as I said, this is not something that they do on a very regular basis. I'd like to thank the panelists once again. I would like to thank the audience. I want to particularly thank Dr. Lawrence Burke for his invaluable help in putting together the concept paper for this particular conference. I want to thank, of course, the Beacon House and the School of Tomorrow teams, which have worked. We've put together 20 sessions, this one just being one of them, with about 70 people in about 15 different countries in a period of 4 weeks. So thank you very much, everyone at Beacon House, everyone in the SOT teams. I would definitely want to thank our lead sponsor, which is UBL, United Bank Limited. Somebody was asking me that, with everything that's happening these days, how is it that you can afford to organize an event like this? So I said, it's because we're not paying for it. Okay, it is being paid for by our corporate sponsor. So thank you, UBL. Your support for this cause is duly noted, and I think everybody appreciates it. 15 seconds, I'm being told. Ladies and gentlemen, please do tune into our 21 more sessions over the remaining 3 days, including my exclusive conversation with Mr. Andreas Schleicher tomorrow at 9:20 GMT. Thank you very much once again, ladies and gentlemen. Thank you, panelists. We are now going offline. Our next session begins, I believe, in about 6 minutes. Thank you.